So, bringing it back to the patient, right? Some of the work that you're doing is either already having or can have a very immediate impact on patients, right? In terms of cancer, in terms of like the immune system. Talk a little bit about that.
We are an RNA splicing company. And RNA splicing, a lot of people don't touch it because it's very complex. It's very, people don't really, understand it that well because there's not that many experts in the field. But then when we design and build a platform to better identify, targets and proteins, we realize a lot of the RNA splicing protein isoforms were built by these, RNA errors. So by doing that, we actually end up building these humongous, I call it a database, but it's a functional transcriptome reference that has, I'm saying it correctly so my co-founder doesn't hate me, because the reality is, for me, it's a database. It has around 14 million possible or potential drugs for patients for different cancers. But the premise is, which one of the 14 million is an actual, can be used to develop a therapeutic, an actual drug? So that's where AI and machine learning comes from. I call it filtering, or, kind of like going through it, the 14 million, and start narrowing it down. But depending on the modality, we focus at Envisagenics to develop immunotherapies. So identifying proteins that are in the extracellular membrane of these tumors from patients that are not present in normal tissues, that we can then basically identify them, are very specific in tumors, have like a little flag, and that flag could then be, with your immune system built into a, conjugated drug or a CAR T, so the immune system can then go and eat it up, and the tumors could be gone, so the patients can be cured. So that's called immunotherapy. And the premise was, hey, identify these proteins that are based on RNA splicing errors, and then that are tumor specific. Use AI to go from 14 million to maybe 5, that you can then design the antibodies, get immunotherapies, and then in a year take them to the patient.